Hello, I am AARP Vice President Bill Walsh, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this telephone town hall in Spanish, press *0 on your telephone keypad now.
Si usted quiere escuchar en español, presione asterisco y 0 en su teléfono ahora.
AARP, a non-profit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. While new coronavirus cases in some parts of the U.S. have started to decline, they are still dangerously high relative to previous surges. Many hospitals continue to be overrun, and Americans are wondering if the pandemic will ever end. And, once again, nursing homes are being hit hard. While deaths have increased just slightly, cases have increased significantly among nursing home residents and staff, stoking fears and concerns among their families. Today we'll hear from an impressive panel of experts about these issues and more. If you've participated in one of our teletown halls before, you know this is similar to a radio talk show, and you have the opportunity to ask your question live. For those of you joining us on the phone, if you'd like to ask a question about the coronavirus pandemic, press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you're joining on Facebook or YouTube, you can post your question in the comments. Hello, if you're just joining, I'm Bill Walsh with AARP. And I want to welcome you to this important discussion about the global coronavirus pandemic. We're talking with leading experts and taking your questions live. To ask your question, please press *3. And if you're joining on Facebook or YouTube, drop your question in the comments section. We have some outstanding guests joining us today, including a top epidemiologist, a clinical testing expert, and another on quality standards in nursing homes. We'll also be joined by my AARP colleague, Jesse Salinas, who will help facilitate your calls today. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member. Or if you're joining on Facebook or YouTube, place your question in the comments. Now I'd like to welcome our guests. Tom Talbot, MD, is the Chief Hospital Epidemiologist at Vanderbilt University Medical Center. Welcome back to the program, Dr. Talbot.
Thanks, Bill. Happy to be here.
All right. We're also joined today by Jennifer Goldman, a doctor of osteopathic medicine, family physician, and chief of primary care at the Memorial Healthcare System. Welcome back to the program, Dr. Goldman.
Thank you so much. Happy to be here as well.
All right. Delighted to have you. And we also have with us today Lori Smetanka, who is the Executive Director of the National Consumer Voice for Quality Long-Term Care. Welcome, Lori, and thanks for joining us again.
Thanks so much, Bill. Glad to be here today.
All right. Well, thanks to all of you. Let's dive right into our discussion. And just remember, a reminder to our listeners, press *3 on your telephone keypad or drop your comments in the comment section on Facebook or YouTube. Let's go ahead and get started. Dr. Talbot, a Reuters analysis of public health data released last week shows that COVID-19 infections are quickly plummeting in areas that were hit hardest during the holidays, while they're surging in the South and the West. How does this complicate public health messaging and efforts to tamp down Omicron's spread?
Yeah, that's a really great question. And I think as we've seen in the last now 2+ years, the messaging has been very confusing and often confounding. And so my advice to folks is yes, indeed, we are seeing the start of the light of the end of the tunnel of cases coming down. And so we need to think globally when we hear that data, but we need to act locally. So while I'm hearing the good news up north where I'm at in Tennessee, we're still on the uptick, and so we need to kind of act appropriately. But overall, it does show some hopeful signs. But don't feel like you should let off your guard and stop masking if your activity is going up just because places north of you or east of you or elsewhere are improving. Just know that hopefully is coming your way soon.
Yeah, I mean, it seems like it kind of sends mixed messages to people, right? Some folks feel like it's time to let down their guard. Others aren't quite sure.
Yeah, exactly.
Yeah. Well, let me follow up on that, Dr. Talbot. I wonder if Omicron, which is a highly contagious but less virulent strain of COVID-19, signals a transition from a pandemic to an endemic, like the seasonal flu. Will things get back to normal this year? And I also want to know if there are any other variants that experts are keeping an eye on.
Yeah, so let's hit on the first part. So I'm always a little hesitant to predict the future because if you go back to just Thanksgiving, Omicron was just a word in the Greek alphabet. And so we saw how quickly Omicron, as infectious as it is, took off, spread across the world phenomenally. So I always get nervous. I think that it's not going to be a light switch where all of a sudden we go from pandemic to endemic. It's going to be a transition. And that transition, germane to what we just talked about, may differ based on where you live, based on how many folks have gotten infected, how many folks have gotten vaccine, and now we're learning even more importantly, boosted with their vaccine to allow that protection so things can't continue to spread. In my part of the world, and we have some counties in Tennessee where we have over half the population that is yet to receive a single dose of vaccine. So we're still not to where we would be endemic in those areas. But I think we're going to get there. And I think what you're seeing is folks kind of taking those baby steps, kind of learning what we can do carefully and safely and within kind of our own risk analysis and thinking of the surge to others. That's why we're not, locking down like we did early on, even though the case numbers are far more than they were before. But we've got to be careful, and it will not be a light switch where we just throw off our masks and be able to do everything we did before. But we've got to learn how we do that, and that's through things like being safe, vaccinating, boosting. If you're sick, stay away from people, early testing, wearing those masks, and kind of gradually getting back to normal. I think in terms of other variants, there's one folks may have heard of this week that has the unfortunate term as the stealth variant of Omicron, which makes people think that means we can't detect it in our tests, which is not true. It's a kind of sister of Omicron that actually looks like it's been around for a while. And the stealth refers to a specific kind of signal that they do see on these testing that they didn't see with the original Omicron. But they all can be tested. We don't know yet right now what that one means, if it's more infectious or cause more trouble. So I think we just have to kind of be patient and continue on with what we're doing. And the next Greek letter is pi, so let's just hope it's a while before we get to that one.
All right. Very good. Thank you so much, Dr. Talbot. Let's turn to you, Dr. Goldman. Debilitating symptoms can last longer for some individuals, a condition that some have called long COVID. Is long COVID real, and what do we know about it, and how common is it?
Absolutely. Long COVID is very, very real. It's known by quite a few names, actually. Long COVID, post-COVID long haulers, or even post-acute sequelae of COVID-19. Really, it's defined as symptoms lasting for more than 4 weeks after infection, and it can occur in anyone who's had COVID, even if the infection was mild. So it's not necessarily predicted based on severity of the infection initially. It can have symptoms like brain fog, which many people have heard of, which really is defined as difficulty concentrating, really difficult to get back to work, difficult to get back to normal. Fatigue, cough, headaches that can be persistent, sleeping disorders, dizziness, even persistent shortness of breath. It's pretty common. On various studies, it's shown really a range of about 20 to 40% of people will actually remain symptomatic at 4 to 5 weeks after infection. And so it's definitely something that is impacting, really at this point, millions of people around the world. We did start a post-COVID long hauler clinic actually in our healthcare system at Memorial Healthcare System within primary care, because what we've seen is that the majority of patients who have long COVID symptoms do well in an environment that is multidisciplinary and that really is coordinated by effective, accessible primary care. And so we started a clinic locally and have seen, hundreds of patients in that practice, and are learning best practices and really how to address some of the symptoms that our patients are experiencing.
Well, that's remarkable. I hadn't heard before that 20 to 40% of people who get COVID could experience the symptoms of long COVID. And I mean, obviously, we're still learning about that phenomenon. How long, if you know, can you tell us, before these, the extreme fatigue and the brain fog will pass? And when does taste and smell resume for those who haven't had it for months?
Sure. So like I said, long COVID, by definition, are symptoms lasting 4 weeks or longer. And that's really the most common time frame. It's about 4 to 12 weeks that people have symptoms after initial infection. After 12 weeks, though, we are seeing that a number of people, in some studies, almost half of people with post-COVID symptoms feel better after 12 weeks. However, we do see that some people continue to have symptoms lasting months afterwards, and even through a year. It is heartening to see, however, that many people do recover at 1 year. However, there are a few that still remain symptomatic afterwards. With regard to taste and smell, this is pretty common. About 40% of people in some studies, have this loss of taste and smell. Most do recover after a month, so after that 4-week time period. However, some people don't recover so fast, and they may remain without their taste or smell for many months, and again through that year. The treatment for prolonged taste and smell is still being investigated. There is some smell training or olfactory training that can be done at specialized centers, but other research is yet to be done to find the most effective treatment. The good news, though, is that for the majority of people, most recover their sense of taste or smell after about a month.
Just a reminder of how much we're still learning about COVID-19. Thanks for that, Dr. Goldman. Lori, let's turn to you. What are the biggest challenges for families in dealing with facilities that care for elderly or disabled people as Omicron surges? I know it's been spreading through those facilities. I mean, it makes perfect sense. Folks were living in such close proximity to each other.
Right. It has been a concern for family members, for residents, and they're concerned about their loved one's safety and also that they're getting the care that they need. And the issues are really related to the spread of the virus and making sure that they're well cared for, but also because there's significant short staffing in nursing homes, not enough people available to provide the care in many homes. So many family members are concerned about that, and also what that's going to mean for visitation, because we know, the last year and the year before, nursing homes were locked down for significant amounts of time. And so they're worried about being able to get in and see and assist their family member. And despite the fact that federal guidance right now says that visitation needs to be allowed for all residents at all times, some states have been putting in place additional safety measures, such as requirements related to masking or testing in order to get at stemming the spread of the virus. So while we all need to do our part in stopping the spread, we've been strongly encouraging, as AARP has, all residents, staff, and family members to be vaccinated, including getting boosters and following infection prevention protocols. It's also really critical that any additional measures that are put into place by states don't make visitation inaccessible for family members. And if masks or testing is required, which we think are reasonable efforts, they do need to be coordinating the federal and state governments with the facilities to ensure that those things are available at no cost to visitors so that we don't have that separation again.
Right. Okay, Lori, thanks so much for that. And as a reminder to our listeners, go ahead and hit *3 on your telephone keypad if you'd like to get in the queue to ask your question live. Lori, let me follow up with you. One of the issues in nursing homes, even outside of nursing homes, has been the uptake of booster shots, but I think it's been a particular issue in nursing homes. And I wonder if you can talk a little bit more about what needs to be done to get nursing home residents and staff boosted.
Absolutely. I think what we know is that the vaccines have made the biggest difference in stemming the spread of COVID, and so ensuring that residents and staff are vaccinated and the visitors is really critical. We need a lot more education around how important boosters are. While we do have high percentages of residents that are boosted, not as high of staff, so that's something we also continue to need to work on. We're not quite there yet with the booster numbers. We need to really get those up in our communities and ensure that residents and staff and visitors have access to boosters. They need to be much more widely accessible, and they need to be given in facilities versus asking residents or staff to go out into the community to receive them, which often is very difficult for them in terms of getting there or making the time to do it. So I think if we replicated the efforts of the initial vaccine rollout, for example, and bring the vaccines to the nursing homes for residents, staff, and visitors, that would make a big difference. And as certainly we look at increasing requirements around vaccinations, it would really be helpful if, as we talk about being fully vaccinated, if the CDC would change that definition to include booster shots. I think that would also help make a difference.
Well, that's very interesting. So if a family wants to make sure that their loved one in a facility gets boosted, they can't count on the facility to administer that? They have to arrange for an outside pharmacy to come in and do it?
Well, certainly there should be coordination between the facility and the long-term care pharmacies that they are working with, but that's being done in better manners than others in some facilities. And so certainly it's something that families need to be asking their facility about getting the boosters and working to coordinate and making sure that they don't have to take the resident out, but we can somehow work with the community to get vaccines and boosters into the facility.
All right, Lori, thanks so much. We'll talk more about that in a moment. And as a reminder to our listeners, to ask your question, please press *3 on your telephone keypad at any time. We are going to get to those live questions shortly, but before we do, I want to bring in Nancy Lamond. Nancy is the Executive Vice President and Chief Advocacy and Engagement Officer for AARP. Welcome, Nancy.
Welcome to you and to our guests. I'm delighted to be here, Bill.
All right. So this week, AARP sent two important letters to the Department of Health and Human Services. One was urging lower Medicare premiums, and the other was asking for Medicare to cover at-home COVID tests. What can you tell us about those issues?
Well, first, AARP is urging the government to reassess the Medicare Part B premium increase that was announced last year. Without a change, these premiums will go up 14.5%, which is just too much, especially considering that half the increase is due to one outrageously priced prescription drugs. It's unconscionable that a single high-priced drug is driving up premiums for all Medicare beneficiaries, many of whom are already struggling to make ends meet.
This issue comes up again and again. If we want to keep Medicare affordable, we've got to fix the underlying problem of out-of-control prescription drug prices.
Yes, absolutely. Prescription drug price reform is AARP's number one advocacy goal for good reason. Last year, an estimated 18 million Americans were unable to afford their medication due to high costs, and Americans are paying 3 times more than what people in other countries pay for the same brand name drugs. The big drug companies will continue to rip off seniors and taxpayers until Congress acts to rein them in, and we're working hard on this.
All right. Now, AARP is also urging Medicare to cover the cost of at-home COVID tests. Why is that so important?
Well, as we've heard from our experts, testing is one of the most effective ways to slow the spread of the coronavirus, which is why private insurers are now required to cover the cost of over-the-counter at-home tests. But Medicare is not covering them yet, even though older Americans are among the most vulnerable for serious complications from COVID. This is a glaring omission. AARP is fighting to ensure that the 64 million Americans on Medicare have the same access to no-cost tests as those with private insurance.
Okay, now, until Medicare acts, all American households are still eligible to receive 4 free at-home tests through the mail. How can people order those tests?
Well, you can order your 4 free tests online or by calling a toll-free number. To request your at-home tests, visit www.covidtests.gov or call 1-800-232-0233. Once you sign up, the tests will be mailed to your home.
All right, very good. That was www.covidtests.gov or call 800-232-0233. Since we're talking with our panel about nursing homes today, there was some news on that front this week too, wasn't there?
Yes. Since the beginning of the pandemic, AARP has been sounding the alarm about the unfolding disaster in America's nursing homes. The pandemic brought to light problems that have plagued these facilities for decades, including staffing shortages, poor infection control, transparency, and accountability. I'm happy to report that our work is making a difference. Just yesterday, the federal agency that regulates nursing homes announced that it has, for the first time ever, posted information about weekend staffing levels, staff turnover, and weekend nurse coverage on the Medicare Care Compare website, so families can have access to that important information. We know that facilities with solid staffing and low staff turnover have much better outcomes for the residents.
All right. Well, that's wonderful news. One last question. AARP's Fraud Watch Network has received complaints about fake COVID testing sites. Do you have any advice on how to choose a safe place to get tested?
Well, unfortunately, scammers are everywhere and will try and take advantage of any situation. The safest bet is to use a testing site recommended by your health department or your doctor, or visit an established clinic or pharmacy. If you do visit a pop-up testing site, be sure to only provide standard information, such as your health insurance card. If you're asked to provide your Social Security number or to pay money up front, those are absolutely red flags. And also, if the staff isn't wearing protective gear or if you feel uncomfortable, listen to your gut and go somewhere else.
All right. That sounds like great advice. Well, Nancy, thanks so much for the update, and thanks for being here with us today.
Thanks, Bill.
All right. It's now time to address your questions about the coronavirus with Dr. Tom Talbot, Dr. Jennifer Goldman, and Lori Smetanka. Please press star 3 at any time on your telephone keypad to be connected with an AARP staff member to share your question live. If you'd like to listen in Spanish, press star 0 on your telephone keypad now.
Si usted quiere escuchar en español, presione asterisco y 0 en su teléfono ahora.
All right, now I'd like to bring in my AARP colleague, Jesse Salinas, to help facilitate your calls today. Welcome, Jesse.
So good to be here today, Bill.
All right, who do we have first on the line?
Our first call is going to be from Rita in South Carolina.
Hey, Rita, welcome to our program. Go ahead with your question.
Thank you. I have a concern about a facility, not a nursing home. It's a rehab place, and they don't demand personnel to be vaccinated, and I have a problem with that, very big one. My husband is there and of age, so it's and they have a change of personnel all the time, and it's very difficult for them. I understand, but it's worse if they get contaminated. by staff personnel.
Right.
How do you find out if they're how much they are vaccinated and stuff? You don't want to be accusatory of the place where he's in, because it's hard to change or find something else.
Yep. Rita, let's ask Lori Smetanka about that situation. Lori, what can you tell Rita and other listeners with similar concerns?
Sure. Well, vaccination of staff, I think, is critically important, and we do have a federal vaccine mandate that is being implemented for people that work in health facilities like hospitals and nursing homes. It's in the process of being implemented right now and will be happening over the next 2 months, where all staff will need to be vaccinated. So that is definitely something that we're happy to see being put into place. I think Rita mentioned that this was not a nursing home. If it were a nursing home, there is vaccine rates for staff on the Care Compare website that Nancy referenced just a few minutes ago, that the federal government operates. But in terms of questioning about vaccine rates for staff in the facility where her husband is, I would certainly talk to the administration about that. Maybe the Department of Health can provide some information, and the Long-Term Care Ombudsman Program might be able to assist you in getting more information as well. And you can find an ombudsman in your area through our website at www.theconsumervoice.org.
Okay, that was www.theconsumervoice.org, and Lori referenced the Long-Term Care Ombudsman. That's a free service to help consumers, advocate on their behalf with long-term care facilities. Let's take another question. Jesse, who do we have up next?
Our next call is going to be Elizabeth in Arkansas.
Hey, Elizabeth, welcome to the program.
Thank you. My granddaughter tested positive on Monday for the virus, and it was recommended that she take ibuprofen and stay home, but she's had a lot of chest pain and just all of the symptoms. And I was just wondering what the recommended treatment at this time is for the coronavirus.
Okay, well, let's ask one of our doctors. Dr. Talbot, can you weigh in on that?
Yeah, first off, I hope she starts feeling better soon, Elizabeth. But I think a lot of that depends on her underlying age and other kind of comorbid conditions. But we have a variety of different treatments we can give folks that are higher risk, those that may have a weaker immune system. We have at least one monoclonal antibody that still works against the Omicron variant, and some oral antivirals. I think the biggest thing is, if she's not feeling well or getting worse, to always link up with her primary provider and make sure that there's nothing else that needs to be done related to COVID. And hopefully she'll turn the corner and be feeling better. And hopefully everyone around her is vaccinated and boosted, so they're not as much risk to get it too. But hopefully she's feeling better, and I would just reach out to her clinician to kind of help with her specifics. But there are some options for folks.
Okay, very good. Thanks, Dr. Talbot, for that. Jesse, let's go back to the phone lines. Who do we have next?
Yep, we're going to take Linda in Indiana.
Hey, Linda, welcome to our program. Go ahead with your question.
Hi, yes, my question is, I have underlying conditions, and I have been vaccinated and boosted, and I am just now past my 10-day quarantine from having COVID. I still have a lot of congestion, and I am really concerned as to if I would get this again, because I call myself being really, really careful. And I was listening to what she was saying earlier about how these symptoms can linger for so long, and I'm 66 years old. So I take medication for rheumatoid arthritis, which does affect my immune system. But I'm really concerned if I'm going to catch this again.
Yeah.
I didn't have to go to the hospital, but it was serious, really serious.
Sure. Well, Linda, let's ask Dr. Goldman about the symptoms of long COVID and the chances of someone who has been, vaccinated and boosted and got COVID of getting it again. Dr. Goldman?
Hi, and thank you, Linda, for that question. And first off, I'm glad that you're starting to feel better and that you've turned the corner with this. That's fantastic news. And I'm also so glad that you've been vaccinated and boosted, because we know that having been vaccinated and boosted, that not only is your chance of getting reinfected lower, but your chance according to many studies now, of developing persistent long COVID symptoms is also seeming to be lower. And so that's very good news. Always with this pandemic is that, there are other variants that we are hearing about. And so there is a potential of getting sick again. That does exist, but you've done absolutely everything you can to protect yourself. And what I would say going forward are a few things. Make sure that you continue to wear your mask. Make sure you really continue to wash your hands. Use hand sanitizer anytime that you go out. Make sure that you avoid, large gatherings, because there still can be spread in any place, and you want to lower your risk. And then lastly, and I really think most importantly, link up with your primary care doctor and make sure that you're talking to them about your symptoms. It's really common to have a little bit of a lingering cough or some congestion for a couple of weeks after COVID. If the symptoms, though, if they last for more than 4 weeks, then that's when sometimes we'll term that long COVID. And that's why having a relationship with your primary care provider and having access to care with them is the most important thing. They can probably see you over telehealth, or you could go into the office and be examined. And so I really recommend that you continue to do that.
Okay, I wonder if the fact that Linda has just recently gotten over a bout of COVID mitigates the seriousness of symptoms if she were to contract it again.
Yeah, that is absolutely the thought. Again, we don't know for sure, because everything is changing with this pandemic and potential other variants. But the data do look good for sure, Bill, that reinfection, and especially severe reinfection, is much, much less likely if you've been vaccinated and boosted, and then, of course, if you've also had a recent infection.
Okay, thanks very much for that, Dr. Goldman. Jesse, let's go back to the phones.
Yep, we're going to take Scott from New Mexico.
Hey, Scott, welcome to the program. Go ahead with your question.
Hi. I'm actually scheduled to get my 4th injection at the end of February. And I was just curious. I am immunocompromised. And again, I'm going to be taking my 4th injection. But my question to all of you is, why, if there's such unsurety about the virus itself and the side effects, why don't they initiate a program where you can get an injection 28 days after your last one and keep this going until they get a handle on the Omicron virus and whatever mutations there might be? Because my doctor made an analogous, which I thought was very accurate. He said getting the shots are like applying sunscreen. And the more sunscreen you apply, the less chance you have of getting sunburn, because you're not going to eliminate the virus.
Right.
So I was just curious, why don't they mandate, if you can get an injection every 28 days, why don't they do that?
Interestingly, like sunscreen. Yeah, thanks very much for that, Scott. Dr. Talbot, can you take that question from Scott, New Mexico?
Yeah, thanks, Scott. And I want to first thank you for getting your booster. So, and for the listeners too, just folks like Scott need 3 doses for their regular series, so the 4th would be his booster. I think it's a good question. I think what we still have to remember is that even without the booster, protection against severe complications from the virus have been really sustained with the vaccine. The booster has kind of added that, and particularly with the Omicron surge, we've kind of needed that. But there is a concern from immunologists that if we vaccinate too frequently, it'll kind of overwhelm the T cells to the point where they just don't react as nimbly when we need them to. So there can be such a thing as too much stimulation of those T cells. So we want to avoid that as well. And so I think for right now, it really is just, that single booster. The big question, I think, on the booster front is, do we need a second booster? Israel has started doing that, and the results are mixed. They seem to boost the antibodies, but not see necessarily an impact in infection. So it's still not clear. So there's an immunologic concern that too frequent may not be helpful. And so that's kind of where we are. But I'm glad you've gotten boosted.
Yeah. Okay. Thank you, Dr. Talbot, for that. And thanks for all those questions. We're going to take more of your questions shortly. And remember, if you'd like to ask one, go ahead and press *3 on your telephone keypad. Or if you're on Facebook or YouTube, just drop it into the comments section. Let me turn back to our experts for a moment. Lori Smetanka, how are nursing facilities addressing staff shortages? You mentioned this before. And what can families do to ensure that their loved ones aren't being, ignored or overlooked?
Sure, it's a good question. Inadequate staffing in nursing homes is a problem that predates the pandemic, but we're seeing critical shortages right now. Nursing homes are required to have sufficient staff to meet the needs of residents. I think people really need to understand that. But we also know that many families help provide support for care and additional care for their loved ones, like helping with meals or helping with grooming, among other things. And this, again, is why visitation is also so important. So a number of facilities are struggling to attract and keep staff, and some are increasing wages and offering bonuses. But we're also seeing a lot of temporary or agency staff and the use of staff who are not fully trained and certified, and that can put residents at risk. So we do encourage families to visit as often as possible in person or virtually stay connected with their loved ones, pay attention to what's happening inside the facility. Nursing homes are required to post their staffing by shift every day, so look for that. It should be in a visible place. And if your loved one or the residents are not receiving the care and services that they need, the residents and families should absolutely raise concerns with the facility administration. And again, they can contact their long-term care ombudsman for help or file a complaint with their state survey agency. And they can get, again, that contact information on the Consumer Voice's website at www.theconsumervoice.org. But definitely raise questions and be vigilant about what's happening in the facility.
All right, Lori, thanks so much for that. Dr. Goldman, let me turn back to you. Let me ask a threshold question. Why are vaccinated people still getting COVID-19? And what is the risk of reinfection for those who have been vaccinated?
And that is such a common question that we get really every day in primary care. The answer is that no vaccine is 100% effective, and that's really the case for all vaccines. But you get vaccinated to prevent severe illness or death from COVID. You also get vaccinated to hopefully decrease the risk of living with long COVID symptoms, because as we're seeing, there does seem to be a decreased chance of long COVID in those that are vaccinated. But you can still get infected. You can still get a mild, relatively mild infection compared to those that are not vaccinated. And so this is why vaccinated people really can still get COVID. The other reason is that the COVID-19 virus is trying to stay alive, and the way viruses do that is that they mutate, and that's what we're seeing with these variants. And so that's the reason why all of the experts on this panel have consistently recommended getting boosted as well, because booster shots really do tend to decrease your risk of getting COVID in the first place. With regard to the risk of reinfection for those vaccinated, we know from studies that unvaccinated people are about 2.5 times more likely to get reinfected compared to those who've been fully vaccinated. But again, as we've seen with some of our callers, and we certainly see in our communities, the risk is not zero. And this is because new variants, again, are continuing to emerge, and they do increase the risk of reinfection. And so most importantly, again, wear your mask, wash your hands, avoid large crowds, get vaccinated and get boosted, and really be smart about your choices during the ongoing pandemic.
Thank you very much for that. We've had a number of requests to repeat the details about how to get free at-home tests. Let me give you that information now. You can sign up online at www.covidtests.gov, www.covidtests.gov, or you can call 1-800-232-0233. That's 1-800-232-0233. So go ahead and order your free in-home COVID test. Dr. Goldman, let me swing back to you. You know, last fall there was a lot of buzz about antivirals. Are they available now, and how do they differ from other treatments?
Sure. So back in December 2021, the FDA did authorize emergency use authorization for two oral antivirals, so antiviral pills that you could take if you're at high risk of progressing to severe disease. Those are Pfizer's Paxlovid and Merck's Molnupiravir, and again, both are pills that you would take. The Paxlovid is approved for mild to moderate COVID in patients who are 12 and older, and again, who are at high risk for progression. So how do you know if you're at high risk? If you are immunocompromised, if you've had a transplant, if you have cancer, if you're on dialysis, if you have very uncontrolled diabetes, lung disease, and some other conditions, then that would make you at higher risk for progression to severe disease. These medicines are offered by prescription only. They have to be given within as soon as possible after diagnosis if the person qualifies, and within 5 days of the onset of symptoms. There are quite a lot of pills. The Paxlovid is 3 tablets twice a day for 5 days, and then the Molnupiravir is 4 tablets twice a day for 5 days. And they do have some side effects. They can cause diarrhea, they can increase blood pressure, they can cause muscle aches, and you can't take it if you have kidney or liver disease. But the good news is that, with the Paxlovid, it reduced the risk of hospitalization and death by it looks like 88%, and then and so that's good news for those that are really high risk of getting very, very sick from COVID. I just want to emphasize, though, that these are not a substitute for getting vaccinated. Remember, getting vaccinated helps protect you from getting severe COVID in the first place, and because we have pill form treatment now of antiviral treatment for COVID, doesn't mean that it's any less important to get vaccinated. The most important thing that you can do for yourself, your loved ones, and your community right now is to prevent yourself from getting COVID in the first place. And if you do get it, even after being vaccinated, the chances is that it's very mild, and you're not likely to progress to severe disease.
Okay, thanks for that, Dr. Goldman. Dr. Talbot, let's talk a little bit about COVID tests. I wonder how the at-home tests differ from those administered by medical professionals. And is there a situation where somebody should choose one over the other?
Yeah, so good question, excuse me, and I'm excited because my home test will be arriving later this afternoon by the mail. I got notification. The way the tests work, the home tests are mainly what we call an antigen test or a lateral flow test. So it measures a part of the viral protein, and the lab tests that you get at your medical provider are often what we call a PCR test that specifically looks for the viral kind of genomic material and try to amplify that up. Both are very good at identifying individuals with COVID. Probably the PCR is a little bit more sensitive, and so may detect cases earlier. But those home kits are very good, and I think the general advice is that have those at home. If you start having symptoms, use the kit, use the test. Make sure you follow the directions. They're very specific. You have to keep the test flat because it has to be lateral, so the flow can be truly lateral. You have to make sure you read it, and sometimes the lines can be a little faint. But they can be helpful, and if those are positive, then that's very reliable. You don't need to go to your provider and get it confirmed with a laboratory test. You need to act appropriately as infected. The one caveat is early on with Omicron, when you have symptoms the first day or two, you may have a false negative home kit test. So the recommendations in the kit are, if you're feeling cruddy, you still stay away from folks, because even if it's not COVID, you don't want to spread other stuff to them. And retest again in 24 to 36 hours with a home kit, or that may be where you decide at that point if you're, to go get a test at your medical provider. But both are quite good to help us kind of identify if we've got COVID and how to act appropriately.
Okay, well, let me follow up on that. When people are tested for the virus, they aren't usually told which variant they have, but doesn't the treatment and the severity differ quite a bit, whether it's Delta or Omicron?
Yeah, so it's interesting. For most things that we do to manage COVID, it doesn't matter what variant you have, whether it was the original strain, the Alpha, the Delta, or now Omicron. The different therapies work, the antivirals, the steroids we would use as well. The one exception that we're finding is that the monoclonal antibody is the one that's very specific. And so you may have seen this week the FDA, at the manufacturer's request, pulled the EUA on 2 of the monoclonal antibodies because they don't work against Omicron. They just don't work. And so that is where it would be slightly helpful. But now with Omicron so ubiquitous, we really assume everyone has Omicron. The challenge is to identify the variant. It's a little bit more complicated testing, so you may not get those results back as quick as you'd like. And so it's kind of sacrificing identifying the infection rather than wait for a while to figure out, not only do you have COVID, but you have X or Y. We'll see down the road if that changes. And, variants are emerging so quickly, it may be hard to keep up with each one. But thankfully, most of our therapies continue to work against all the variants to date. So.
Okay, Dr. Talbot, thanks so much for that. Now it's time to address more of your questions with Dr. Tom Talbot, Dr. Jennifer Goldman, and Lori Smetanka. As a reminder, press star 3 at any time on your telephone keypad to be connected with an AARP staff member and ask your question live. Jesse, who do we have up next?
Our first question is going to be from YouTube. Joanne asks, are you guys aware of any issues with false test results with the home kit?
Dr. Talbot, can you weigh in on that? You were just talking about testing.
Yeah, I apologize. I actually could not hear Jesse at all, so didn't hear the question.
Wondering about, yes, they were wondering about issues of false positives with the in-home tests.
Yeah, there have been some reports of some false positive testing, particularly in those that are maybe asymptomatic. I think if you've got clinical symptoms suggestive of COVID, then more reliable. They do happen. They're fairly infrequent. We've had a couple instances of folks who may have, for travel reasons and gone to get the laboratory test. And I think that may be an instance where you may want to confirm that. But it's not very common with the home kits.
Okay. All right. Thank you very much. Jesse, let's go back to the lines.
Let's bring Vanessa from New Mexico.
Hey, Vanessa, welcome to our program. Go ahead. Hi, go ahead with your question.
Sure, yeah. I was wondering, moving forward, a little bit bigger picture kind of question. We have various national standardized certifications for companies or of the sectors, like, say, the ISO certifications. Are the nursing homes now certified for any kind of things like this, disaster response, pandemic/medical response? And if they are not, is there anything maybe being looked into for the future of developing them? Because we can maybe utilize something like this in making a decision on which nursing home to select. If we know they have some sort of response set up for stocking of supplies, response levels, staffing certifications, licenses, things of that nature, because it seems like early on in this pandemic, there was a lot of confusion and there wasn't any consistency with the nursing homes on how they responded to this pandemic medically.
You're absolutely right about that, Vanessa. Well, let's ask Lori Smetanka. She's an expert in this area. Lori, what can you tell us about any certifications moving forward and lessons learned from the COVID-19 pandemic so far?
Sure, it's a great question, and we definitely need to be learning all the lessons we can from this pandemic, right? Nursing homes, and the vast majority of them, more than 95% of them, are certified for Medicare and Medicaid, meaning they have to meet certain requirements set by the federal governments, and that includes emergency preparedness. It also includes preparedness for a variety of different kinds of emergencies and disasters, including pandemic. So nursing homes are required to have emergency plans, to coordinate with their state and local health departments, and to have policies and procedures in place for response. The caller is absolutely right that we saw a lot of confusion in the beginning, and that related quite a bit to the sharing of information and a lot of different types of guidance that was happening. So hopefully we will learn from that moving forward, and there will be a more coordinated effort in terms of responding and requirements related to reporting of information. But people should also educate themselves about the nursing homes that they're looking at. There's good information on the Care Compare website that is operated by the federal government, and you can access that at medicare.gov. And you can get information about staffing levels, about vaccine rates, and about how the facilities do on their annual surveys. So you can get some pretty good information about quality levels in nursing homes. And also certainly ask questions of the facilities that you're working with, of your friends and neighbors, and also certainly contact your long-term care ombudsman for additional support and questions with respect to helping to choose a nursing home in your community.
Yeah, that's a great point. And a reminder to all of our listeners that there is ombudsman service in every state, and that's a free service for consumers. And I'll just give a plug to AARP's own nursing home dashboard, where we are tracking infection rates and vaccination rates in facilities around the country. You can access that on our website at aarp.org/nursing home dashboard. All right, Jesse, let's go back to the lines. Who do we have next?
Our next caller is going to be Mike in Florida.
Hey, Mike, welcome to our program. Go ahead with your question.
Hey, thanks for taking my call. Just for one of the doctors, a quick question in terms of once you've had COVID and I'm actually scheduled for my booster, should there be a certain time frame from when you recover to when you get your next inoculation shot?
To when you get your booster, is that what you're asking? Yeah. Okay. Well, Dr. Talbot, why don't we take a run at that? Is there a recommended time frame?
Yeah, so the general advice we give is if you have COVID, you need to wait till you're no longer infectious, to go get your booster. And then after that, you actually may go ahead and go get your booster. Now, you probably do have some protective immunity from that COVID infection, but the issue is that may vary. We don't know, with milder cases, how long that lasts. And so we worry with some folks saying, you can wait X or Y months. You may kind of forget about that and then be vulnerable. So it is fine after you come out of isolation to go ahead and get your booster and kind of proceed from that. It's also okay if you want to wait a little bit. I just get reluctant on saying wait a little bit because that may draw from 1 to 2 to 5, 6 months, and then that's too far out. So I've been telling my patients, once you're out of isolation, just go ahead and go get that booster and get that knocked out.
Okay. Thanks very much for that, Dr. Talbot. Jesse, who do we have up next?
Our next question is from Maritza on Facebook, and she asks, can my grandmother be vaccinated at 95? She seems in good health.
Dr. Goldman, can you weigh in on that?
Yes, I can. I definitely recommend your grandmother being vaccinated. I recommend everybody's grandmother, grandfather, and everybody else to be vaccinated. We haven't seen any concerning information about getting vaccinated in later in age, and so in fact as we get older, our immune system can sometimes weaken, and so in fact vaccinating someone in their 90s is the best way to protect them from getting severely ill with COVID and needing to be hospitalized or worse.
Okay, thanks very much for that, Dr. Goldman. Who do we have up next, Jesse?
We're going to bring in Marlene from New Jersey.
Hey, Marlene, welcome to the program. Hey there, go ahead with your question.
Yeah, thank you very much.
I'm very interested in infection control. My brother died in a nursing home following surgery. He was there for his rehab, and unfortunately they failed to properly isolate residents who tested positive for COVID-19. They didn't adequately screen or test the employees. There was so much, it was just awful. And I can go on and on. It's a very sad story.
That's terrible.
And,
I'm so
what
sorry.
I would like to know is the Attorney General from New York recommended that every nursing home, as well as hospitals and all long-term care facilities, she felt, should have a full-time infection preventionist in each home. How feasible is this to pay for something like this in each home instead of giving these jobs? I'm retired, but I worked 43 years as a PT, and I noticed when people had to do infection control, they had 100 other jobs to do. And can't we just hire full-time infection preventionists? That their job is to keep that facility safe, and that's their full-time job? Is this possible? Because I thought the Attorney General of New York had a wonderful idea.
Well, first, I'm so sorry to hear about your brother. Let's turn to Lori Smetanka and talk about this proposal about having a full-time infection preventionist in facilities. Lori?
Has been suggested, and there's actually some legislation in Congress right now that does include that provision, and it's something we are strongly supportive of, and we think it would go a long way to helping with infection prevention and control in facilities, which is, by the way, even before the pandemic, the number one deficiency or problem that's been cited in nursing homes across the country. So even before we were dealing with the pandemic, infections and infection prevention and control has been a serious problem in nursing homes, and one we definitely need to get a better handle on, and I think the pandemic has really just reinforced that. So there is a proposal to support that in Congress right now. It's one that we are advocating for and would like to see cross the finish line and get enacted.
Okay, Lori, thanks so much for that. And Lori's mentioned a couple of times the long-term care ombudsman programs around the country. I wanted to give that website out again. It is the www.theconsumervoice.org. Go there to look up the ombudsman program in your state if you need some help working with your facilities. Let's take another question. Jesse, who do we have up next?
Yeah, we're going to take Diane from Wisconsin.
Hey, Diane, welcome to the program. Go ahead with your question.
Hi. My question is, I know we've been talking about nursing homes a lot, but I want to know, can you hear me?
Yes, go ahead.
Okay. I want to know, are nursing homes and assisted living facilities held at the same standards? In other words, do they have like the same nursing homes and assisted living facilities?
Right. No, it's a great question. Lori, can you help Diane out with that?
Sure, it's a great question and one that creates a lot of confusion for people. They are not held to the same standard. Nursing homes that are certified for Medicare and Medicaid, which is, as I mentioned earlier, more than 95% of them, have to meet standards set by the federal government, and they're bound by the rules that the federal government set and have to meet those. Assisted living facilities are regulated and licensed at the state level, and so they have to meet state requirements. And as you can imagine, they vary widely across the country.
All right, Lori, thank you so much for that. And thank you to all our experts. This has been a really informative discussion. And thank you, our AARP members, volunteers, and listeners for participating in the call today. AARP, a nonprofit, nonpartisan membership organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others while taking care of themselves. All of the resources referenced today, including a recording of today's Q&A event, can be found at aarp.org/coronavirus beginning tomorrow, January 28th. And if you're looking for Medicare assistance during COVID-19, please visit shiphelp.org/COVID-19. That's ship, shiphelp.org/COVID-19. Go there if your question was not addressed. You'll find the latest updates, as well as information created specifically for older adults and family caregivers. We hope you learned something that can help keep you and your loved ones healthy. Please join us on February 10th at 1 p.m. for another live coronavirus Q&A event. We hope you can join us. Thank you and have a good day. This concludes our call.